Is this thing on? Oh, I see the red light now. Okay, I see. Right. Good morning. My name is Oscar Lewis. This week in science, we were researching something called a genetic disorder, and I was doing so much research that last night I had a dream, and in the dream I was teaching a class about a genetic disorder, but the weirdest thing was that everything was Lego. And the fact that I was bald. Wow, this is a dirty floor. Good morning, class. It is Sunday, so we don't have very much time together today, and we have a lot to cover. Before we start, Tommy, please take that thing off your head. And remember, I'm a fast talker. I don't breathe as much as you do, so keep up. Thank you. Okay, here we go. Today you will be learning about adenosine deaminase deficiency. It is also known as ADA deficiency, severe combined immunodeficiency, or SCID, due to adenosine deaminase deficiency, ADA SCID. Yes, sir. George, we have a test on Friday that covers this, so I highly suggest taking notes instead of whispering to your friends. As I was saying, ADA deficiency has many different names. The name adenosine deaminase deficiency comes from the lack of the adenosine deaminase enzyme in a patient's red blood cells. It was discovered in 1972 by Dr. Eloise Giblett. She discovered it when a patient's blood sample was sent to her at the King County Central Blood Bank in Seattle, Washington. The patient in question had a cellular immune disorder, and the doctors could not find a suitable donor for a bone marrow transplant, which was the only cure for SCID at the time. So that they sent the blood sample to Dr. Giblett, hoping she could identify a suitable donor. An examination of the blood sample, Dr. Giblett found that the patient's red blood cells were completely devoid of ADA activity. Everyone, pay attention. Thus, ADA deficiency was discovered. ADA deficiency is an autosomal recessive metabolic disorder. This means that two copies of the abnormal gene have to be passed on for the trait to develop. If only one gene is passed on, then the offspring is a carrier. And a metabolic disorder is a genetic condition that results in problems with the chemical reactions of the body that convert and use energy. ADA deficiency is caused by a mutation on chromosome 20, which you can see on this piece of paper. Chromosome 20 holds the gene codes for, along with other things, the adenosine deaminase enzyme, or ADA enzyme. The ADA enzyme is located at position Q13.12, which is the long arm of chromosome 20, position 13.12. With the mutation, the body cannot produce the ADA enzyme. Without the ADA enzyme, the body cannot break down the chemical deoxyadenosine, which then destroys the T and B lymphocytes. The first orchestrates the immune system's response against infected cells, while the second is a type of white blood cell that circulates in the bloodstream and produces antibodies when it encounters any antigens. The lack of these lymphocytes vastly diminishes the immune system and leaves the human body vulnerable. This leads to a variety of signs and symptoms which usually develop before 6 months of age. Some of the symptoms include autoimmune hemolytic anemia, which is when the antibodies form against the body's own red blood cells and destroy them, B. lymphocytopenia, which occurs when the glands found throughout the lymph vessels hold on to too many B lymphocytes instead of releasing them into the bloodstream, SCID, and many more. But about 10 to 15% of people affected by ADA deficiency have symptoms that develop between 1 and 10 years of age. This is called delayed onset. In some states of the U.S., newborns are screened for various conditions that can cause severe combined immunodeficiency, like ADA deficiency. Doctors usually identify ADA deficiency during the mother's pregnancy one of two ways. They either take a sample of tissue from the amniotic sac where the baby develops and test it, or the doctors look at the ADA enzyme levels in a sample of fetal blood taken from the umbilical cord. After birth, the doctors can take a blood sample from the baby for more accurate testing that demonstrates evidence of combined immunodeficiency, like low levels of certain lymphocytes or low levels of the ADA enzyme. Other helpful tests in the regard of establishing a diagnosis includes X-rays and genetic testing to identify mutations. You have a question?
Yes, what is the average life expectancy for people with the disorder?
Most affected individuals do not survive past age 2, so in these cases, the main effect of the disorder is death. However, in the cases of delayed or late onset, over time, affected individuals may develop malnutrition, chronic lung damage, and other health problems. Treatment for ADA deficiency usually consists of 3 things: early diagnosis and therapy for bacterial, fungal, and viral infections, prophylactic medications for certain types of pneumonia. Prophylactic refers to a course of action used to prevent a disease, and intravenous or IV immunoglobulin to boost the body's natural response to infections. Also, during treatment, it is important to restore the function of the immune system. The most effective treatment in this regard is the transplantation of blood-forming cells from the bone marrow of a healthy individual. This is called BMT-SCT, bone marrow transplant / stem cell transplant. This therapy cures 70% of people with SCID, including those affected by ADA deficiency. If stem cell transplant is not an option, then enzyme replacement therapy, ERT, may be recommended instead. ERT replaces the ADA enzyme with a synthetic form of the gene. Gene therapy with a non-myeloablative conditioning, which means that the therapy causes minimal cytopenia or reduction in the number of mature blood cells, is an option to be considered for all patients with ADA SCID who lack a human leukocyte antigen identical sibling donor. The prognosis for people with ADA deficiency varies upon the severity of the condition, the timing of the diagnosis, and the response to treatment. Without early diagnosis and treatment, most individuals do not, like I mentioned earlier, survive past 2 years of age. But if bone marrow transplant or stem cell transplant is effective, the prognosis of the individual is typically very good. There is one interventional study being sponsored by Great Ormond Street Hospital for Children in London, England, that is testing the reliability of gene therapy via the lentiviral vector. It is currently recruiting participants, and they hope to have results by December 2018. In lentiviral gene therapy, doctors introduce a normal copy of the human ADA gene into the stem cells of a patient's bone marrow using the lentiviral vector, which is the method by which genes can be inserted, modified, or destroyed in organisms using lentivirus. Lentivirus are a family of viruses that are the cause of well-known diseases like HIV. These gene-corrected cells are then transported back into the patient after a small dose of chemotherapy, which kills off the old stem cells. The new stem cells can now survive in the body and make lymphocytes. They hope to prove that gene therapy via the lentiviral vector is safe, feasible, and effective. One great story about gene therapy helping to cure adenosine deaminase deficiency was in the case of Colton and Abigail Ainsley. This is a picture of them. They were both born with severe combined immunodeficiency due to adenosine deaminase deficiency. When Colton was diagnosed with SCID, he was flown to Los Angeles, California, where he met Dr. Donald Kahn, a leading doctor in ADA SCID, who has spent about a decade collaborating with researchers in the creation and testing of a new type of gene therapy capable of restoring immune systems in children. Colton was one of a couple kids that were given this treatment. He was given a low dose of chemotherapy before gene therapy at the age of 1.5. Colton was one of a few that had their immune systems fully restored. Abigail was also diagnosed with ADA SCID at birth and was given a slightly larger dose of chemotherapy than Colton and the same gene therapy. This actually worked better than Colton's treatment, showing that the treatment is more effective when given at a younger age. While Colton will need minor injections for the rest of his life to keep his immune system well and healthy, Abigail would likely not require them. This is the first known full restoration of the immune system in an ADA deficient person. Remember, there is a test on Friday, and a passing grade is a Z- or above. See you tomorrow.